Hi, so today we're going to be talking about the human immunodeficiency virus, also known as HIV, and those that will be presenting are Daniela Gill, Peyton Hamilton, Adriana Ramirez, and Julia Summer. Okay, to start off, so the client that we have today, his name is Gary Edwards. He is a 46-year-old man. His date of birth is March 18th, 1977, and he has HIV. He also has a comorbidity of depression that he developed after being diagnosed with HIV. Currently, the medications that he's on are Prozac, also known as fluoxetine, and Epivir, also known as lamivudine, which the Epivir is for his HIV and the Prozac is for his depression. And here we just have a picture of our client on the left. Okay, so client's occupations. Gary is a district manager for the popular company Starbucks in the Upper East Side of Manhattan. He often works long hours and has great work ethic. Gary currently lives with his partner Eric in a 16-story apartment building in the Bronx, so his commute is about 30-40 minutes every morning. Gary and his partner are pet dads to their Bichon Frise, Max, who they normally take on long walks, and they like to go to Central Park to get some exercise. Gary aims to exercise at least 3 times a week, especially after being diagnosed with depression. He is currently trying to improve his mental health by incorporating exercise such as walking and going to the gym. He's also started CBT therapy to also help with his depression.
So HIV's effects on occupation. So after Gary was diagnosed with HIV at 41, he developed depression. The stigma surrounding this disease further increased his maladaptive thoughts, which led him to go into therapy. So being depressed negatively impacted like his relationships with his partner, with his friends, with his family, and most times, Gary resorts to isolating himself from them when he's in this depressive state. Um, Gary has to work long hours to afford to pay his medical bills, which adds upon more stress due to being diagnosed. So, along with this stress came some mental health factors as well. Gary usually mostly suffers from low energy and fatigue, which affects him working at his full capacity than he did before. And Gary's occupations as in sexual activity also changed due to his diagnosis, taking a toll on his relationship with his partner. So, what is HIV? HIV is considered a retrovirus, which attacks the individual's immune system, causing it to weaken and be more susceptible to more sicknesses and more diseases. The body usually becomes more susceptible to bacterial infections and other diseases as well. HIV attacks the CD4 white blood cells in the individual, and this usually leads to the patient or the client obtaining AIDS, which is an acquired immunodeficiency syndrome, and if not, when not treated.
All right, the signs and symptoms for HIV. The early signs and symptoms may not arise right away, but they are still infectious. So these symptoms include flu-like symptoms, which require chills, fatigue, fever, mouth sores, muscle aches, rashes over the body, sore throat, swollen lymph nodes. So the symptoms that are only acquired in women are included in inflamed pelvic region, yeast infection, and vaginal pain during intercourse. And this is a picture of where all of the organs are affected in this picture. All right, so the transmission of HIV. So the virus is transmitted through bodily fluids such as semen, vaginal fluids, blood, and breast milk. So people that are most likely to get the virus is sharing of a dirty needle or vaginal or anal sex. So for HIV positive mothers during vaginal childbirth. So the statistics is it existed in the US since at least mid to late 1970s. 38.4 million people living with the disease as of 2021. 2/3 people with HIV live in Africa. And if you see this picture, this is just the statistics in Africa. So 650 oh my god, 650 people, 1,000 people died due to the HIV virus in 2021.
Okay, so some recommended clinical precautions as well as some interventions. So some precautions is make sure to wash hands often, cover all cuts. So you can also should wear gloves, gowns, and masks. Avoid skin contact and limit sexual partners. And some interventions is have condom use. Make sure that when you're injecting stuff, it's cleaned and the right equipment is being used. The treatment of sexually transmitted infections, as well as HIV testing and counseling. So with this diagnosis, although it's for life, there's nothing that can be done to take that diagnosis away. These precautions and interventions not only protect the individual with this diagnosis, but also the other people that they interact with. So the next slide is some treatments. So there's no actual cure for HIV, but can control with a certain treatment. So there's no vaccines available up to this point. So there's an anti-retroviral therapy known as ART, as well as it's called like a cocktail therapy. So it includes so many different factors. So it can involves like a combination of different medications that the individual has to take on the daily basis. It won't cure HIV, but it helps individuals with HIV live longer and healthier, like a healthier life. It also reduces the transmission rates to other individuals. And most people can get the virus under control within 6 months with this kind of cocktail therapy medications. So this treatment does not prevent transmission of other sexually transmitted diseases. Yeah.
So the role of OT on HIV is helping with energy conservation techniques when fatigued or experiencing fluctuating symptoms. We also find ways to adapt to tasks to make them more manageable, obtain devices that can improve safety and independence when completing daily tasks, educate by providing strategies patients to be able to self-manage their disease, as well as educate on prevention of further spread of virus. So some other professionals that can offer help to HIV patients are psychologists, general practitioners, pharmacists, and social workers.
With this whole team of professionals, what's important is that this diagnosis can be very overwhelming due to the stigma it had years ago. So throughout time, we're trying, like, with this diagnosis, an individual, their mental health state might deteriorate just because they're going to isolate each other themselves. It's a lot of different factors. They have to take care of medication, they have to work on mental health, they have to socialize, and at some point with their sexual partners have to tell them about their diagnosis. So it comes with a lot of different overwhelming factors. And that's why these different professionals, like the bigger the team, the more collaboration that they have with different individuals, from social workers to medication to psychologists, is going to be very helpful.
And then our last slide is just our references. Thank you.
Thank you.
Thank you.